And what does that mean? Well, our check starts off with the head. So we're looking for any lumps, bumps, bruisings from the birth and checking the soft spots. We have 2 soft spots on the baby's head, one at the front and one at the back. And so we're checking that those are there and everything. So then we come down and we measure the baby's head. So the head, we measure the circumference of the baby's head to check that baby's growing right and that growth then doesn't get too big or too small. So that happens with the circumference of the baby's head. And then we come down to the eyes, 2 eyes, making sure there's 2 eyes and that the eyes can open. And when we check the eyes, we then check the red eye reflex, which when you have a photograph taken, you will see that sometimes you get red eye, which is just the reflection of the light on the retina at the back of the eye. So we shine a light in baby's eyes to check that we can see that there is that red reflection on the eyes. So we have that. And that makes sure that baby can see and baby doesn't have cataracts and things. So then we check that the baby has 2 ears and those look normal and there's no webbing behind the ears, and that the neck, there's no webbing in the neck. We check the nose, that there's just 1 nose, which quite often there is. And then the mouth, have a good look inside the mouth, make sure that the roof of the mouth is intact, and sometimes pop a finger in and have a feel of the mouth. But the best way to do it is to by vision, to have a look and shine a light in. And if you do pop a finger in baby's mouth, a clean finger in baby's mouth, then the baby will suck on the finger, so you can check the sucking reflex there as well. So coming down, making sure the arms are of equal length, that there's 4 fingers and a thumb on each hand, and look at the creases on the palm of the hand as well. Okay, so popping your thumbs in, baby will close its hands around your thumbs, so that's a grasping reflex that we're checking, and we pull baby up and having a look at the head as it's coming up, and then popping a hand behind the baby's head, gently let go of the baby and the baby will throw its arms out in a startle reflex. So coming down, looking at the chest, quite often due to mum's hormones it will look like boys have boobs, but that will go down. So looking at the chest, making sure that the breathing is nice and equal, that the chest is rising evenly when the baby's breathing. So then having a listen in to the baby's chest, listening to the heart sounds, listening to breath sounds, making sure that both lungs are inflating. We'll have a listen, and just have a listen at the back as well to see if you can hear the baby's chest is clear and that the breath sounds are equal and even. So then coming down to the baby's abdomen, having a feel of the abdomen just to check that the abdomen is soft and that there's no enlarged organs that you can feel. The cord, making sure that the cord clamp's secure. And then coming down into the groins to make sure you can feel 2 pulses in the groins and that they're nice, strong and even, to make sure there's blood flow down to the legs. And then it's quite difficult in this doll, but we're going to check the hips. So checking the hips, we want to make sure that the baby's hips aren't clicky and aren't dislocated. So just bending the knees and then just moving, apply some pressure and moving the hips out to the side, and that will tell us if the hips are clicky or not. We'll feel it under our hands. So then making sure that the legs are equal, and that there's the correct number of toes on each foot and that there's no webbing between those toes. Coming up then, popping a thumb on the base of each foot to make sure that the toes curl round the thumbs. That's another reflex that there is on the bottom of the foot. And then turn the baby over and have a look at how the tone is of the baby, holding it across your arms, and then coming down the base to the base of the spine to make sure that the spine is complete and that babies are going to be able to poo there and pass meconium would be a good idea. Then, if checking and making sure that it is a boy or a girl and that the boy's testicles are descended and that they can pee straight would be a good idea to have a look at. So that's just an overall check for baby that we have to do. And so we're going to keep baby nice and warm because newborn babies lose their temperatures quite quickly because they haven't adapted to being outside. They're used to being in a nice warm environment. And what we also do is we weigh babies. And so we pop the baby on the scales. It's always a good idea to get the weight first before you phone anybody to tell them that you've had a baby. So you need to check before you phone anybody that whether it's a boy or a girl and how much they weigh, because that's what everyone always asks first. The other thing that we do is actually measure baby's length. So I'm just going to wrap and keep my baby nice and warm as well. And take my baby off the scales and putting my scales over there. I'm now going to measure the baby. Now the best way to do this is on a measuring mat, and probably the most accurate measurement is going to be at that first week, because in the first 48 hours it's hard to get a baby to uncurl and stretch out nice and straight. So we put baby on the measuring mat, stretch them out and see where their heels come to, and that's the length that baby has. And that's how we check a baby over. Let me just bring that measuring mat down for you. So there, that's how we do a whole check on the baby. Okay. The other thing that we have to do, or we ask you about, because you're baby now and you're the parent, and so we ask your consent, is that when baby is over 48 hours old, between 48 hours and 5 days old, when baby's had a few feeds of milk, and usually probably when their dirty nappies start to change colour, because the first nappies that babies pass are a dirty black meconium tar-like substance, and then as the milk enters into their system, those change into a browny greeny colour and then into more of a browny yellow, and breastfed babies tend to pass more very watery yellow poos. So when baby is doing that, then we can test for lots of different, it's actually over about 50 different metabolic disorders, so I'm not going to go through them all individually. One of the main ones being a PKU, it's a phenylketonuria, and that is just helps babies who are intolerant to that and can't tolerate certain things will not thrive, and so that means that we do a blood test on babies. Now this blood test is just done with a heel prick, so we have a little heel prick tester here. So we put that against the heel, on the outside of the heel. We want to avoid all the nerves that are running down the centre of the heel, so we go to the outside of the heel, give a nice prick of the heel. It's very short. And then this is the card that we use to then we fill up these little circles here. So we put those, and it's important that each circle is filled, preferably with just one continuous drop of blood. And then we fill out the details, and these cards get sent to Auckland, and we don't tend to hear anything back unless there is a problem. And you can request these cards back. You send for a special form, and if you want to, you can have your cards sent back to you. So that's really basically, in a nutshell, what I want to do when I talk about vitamin K is actually probably send out a information sheet about vitamin K, because vitamin K is slightly more complicated to cover with a video. Okay, so I'm just going to wrap my baby up again and keep my baby nice and warm. And that's it for baby checks.